to come up. What's up, y'all? All right. I'm going to make sure you guys can see and hear me. Give me a thumbs up if you can see and hear me. How y'all doing today? Happy Sunday. Happy Sunday. I'm really hoping y'all can hear me, because if not, I just look probably insane. Let's look and see what my loves are doing. All right. Can y'all see me? And hear me? Okay. So you hear me as garbled? I can see audio. Okay, let's look and see what the hell's going on. Can you hear me now? Can you hear me now? Is it better? So better if it's better. If it's still garbly and chopped up, let me know. I just want to make sure y'all can. Okay, I can see that y'all can see me. Just want to make sure y'all can hear me. It still sounds bad. That's so weird. Hold on. What is happening? Staticky still.
What about now? Can y'all hear me now? Yeah, you can hear me? Woo! All right, cool. I don't know what I was about to do. Yay, awesome. I'm so sorry about that. Wow. Wow. I hate when that happens, but whatever. Life happens, right? Keep it pushing. All right, so thank you guys for having the patience with me because let me tell you, I was losing my patience. I was about to break something, okay? Welcome to Sunday Study Hall. All right, this is brought to you by Study Bar Community and me, Nurse Sam. I'm going to be your host. So we're trying something a little new, a little different. Okay. What we're doing is every Sunday, at least for the summer, we're, like I said, we're testing and trying to see if this is something we want to continue doing and seeing if it helps you guys, if you like it. But every Sunday, we're going to be reviewing over a different nursing topic. Okay, so this week, it's gonna, I wouldn't say kick it off because we did like end on a couple things back before, but now I want to make it free and open to the public, and then just replays will be in the study bar community. If we do something exclusive with the study bar community, then it'll be obviously still in the study bar community. But like I said, tonight's topic is common NCLEX lab values. Common ones, the common ones that it doesn't matter if you're RN, LPN, Jennifer Lopez, doesn't matter. You're going to need to know these lab values in order to be successful on the NCLEX. Okay, so I just want to go ahead and stop it. Let me make sure y'all can see that. Can y'all see that? Can you see it? Let's go ahead and move this kind of up there. Make it just a little bit bigger for the brows so we can see the brows. Can y'all see that screen? Can you see the screen? Perfect. Awesome. So we're also going to be going over like memory tricks and stuff like that for those lab values as well. Like I said, hello and welcome to everyone. I am Nurse Sam. I'm a licensed practical nurse and I've been so for 8 years. I did bedside for 6 of those 8 years. And for the last 2 years, I've put 100% into Nurse Sam Global Media, my company, which was created to help you guys and visual learners have fun when you're studying so that you retain more of what you're studying and you're able to recall it faster when you need it. Okay, so I help pre-nursing students get into nursing school. I help y'all get through nursing school, help y'all get out of nursing school, and then ultimately, I definitely help you guys take and pass the NCLEX. Okay, I have helped over 25,000 nursing students through nursing school to become RN or LPN. At least once or twice over. Like I've helped people go from LPN to RN. So I've definitely had experience in that area as far as training you guys. I've been doing that, like I said, for the past 3 years, 2 years full time. So that's just a little bit about me. Tell me about you guys. What's your name? I can kind of see it, but tell me what's your name, where you're from, and what nursing program are you in, LPN or RN? It doesn't matter. Both of you guys are still going to, both groups are still going to need the same information, but I just like to know kind of a little bit about you guys. So once again, what is your name, where you're from, what you repping, and what nursing program are you in? LPN or RN or LVN, depending on if you're like Cali or Texas. But tell me a little about you guys. It's your turn. It's definitely your turn. Okay. Chicago. Woo. Hey, Heidi. BSN grad. Awesome. Awesome. So I'm assuming you're waiting to take your NCLEX. I am assuming. Monique, California, ADN program. Awesome. Janaya, South Carolina. BSN student. Shantice, Maryland, LPN program. What's up? Shantae, LPN, Denver, Colorado. Chelsea, Florida, RN. I'm from Florida too, from Fort Lauderdale specifically. L's up, 954. You know. Who else? Ida, LVN in California. Welcome, welcome. Latia from New York. I was just in New York. Oh my God, I love it so much. I was in like Manhattan. I'm in the LPN program in my 3rd semester. Congrats and welcome. Erica from Ohio, new grad LPN. Congrats on graduating, girl. I'm not even going to be like everybody else and ask you when you're going to be a real nurse or when you're going to finish the real nursing program. Girl, I hope you haven't gotten that too much. But congratulations on graduating. Next step is pass that NCLEX, right? That's why you're here. Who else did I miss? Wait. Erica from Ohio. Did I say that? Teria just graduated RN program in May. Congrats. Yvette, New York, new grad LPN. Congrats. Akia, Florida. Whoop whoop. RN ADN program. Jamia from Philly. And you start your RN program in the fall. Awesome. Teria, Pittsburgh. Tanya, Tennessee, LPN. Zania, LPN grad, Bridgeport, Connecticut. Nicole, Cali, LPN, getting ready to take the boards. I know that's right. Good luck to everyone that's waiting to take the boards that have already graduated. Y'all got one more step. Just one more step. Take and pass that NCLEX. Camilla from South Carolina, recent BSN grad. Chelsea, Cheryl, and Lisa, Maryland, people waiting to take the boards. Marjorie, I'm in Miami. Whoop, whoop. I'm in the RN program, just graduated. I'm waiting to take the NCLEX. Congratulations. Good luck to you. And Shakia, LPN program in Chicago. Awesome. It was nice to meet all of you guys. Thank you so much for spending your Sunday afternoons with me. We're both going to definitely, all of us are going to definitely benefit from this. Okay, so thank you so much for joining me. Once again, there will be no replay of this unless you are an enrolled member of the Study Bar community. Okay, we recently lowered the price from $29.99 a month to $14.99 a month. You still get everything else that you got when it was double the price. But I wanted to make sure it was a little bit more affordable for you guys, especially because of the price of gas and everything else going up. I don't want to contribute to that problem, okay? I just want to make sure y'all have that information, resources, and everything that you need to be successful, okay? Let's go ahead and go into our content. Okay, so first of all, does everybody here have the ultimate nursing school bundle or the first semester or at least the first semester bundle? Does everyone in here right now, does everybody have the ultimate nursing school bundle and or the first semester bundle? Obviously, if you have the first semester bundle, well, I won't say obviously, I'm just let you know this just to make sure you do know this, but the first semester bundle is included in the ultimate nursing school bundle. So some people like to start with the first semester, and then when they see how bomb it is, because it's always so bomb, 5 stars, period, they go ahead and upgrade and they get the ultimate nursing school bundle, which includes all semesters plus some exclusive study kits that you can't get anywhere else or in any of the other study bundles or by itself. So I just want to just see if y'all have it. Okay, so yeah, so remember, if you have the ultimate nursing school bundle, then you have the first semester bundle. It's within it. It's all 3 semesters. All right, awesome. I'm so glad that for all the people that do have it, awesome. I hope you're loving it. I'm glad that you're loving it. For everybody that says no, couple things. All right, regular price is $97, but because you guys are here with me today, I'm going to give you guys a coupon code for 40% off. I'm sorry, 50% off. 40 was something else. Yeah, but yeah, I'm gonna give you guys a coupon code for 50% off towards the end of this, so you guys can use that to get either the first semester bundle or the ultimate. I recommend the ultimate just because, like I said, it has majority of everything minus like the T study kits, because it's a totally separate bundle, and minus the critical care, just because that started after the bundle was completed. But yeah, all your lab stuff is definitely within the Ultimate Nursing School bundle. So I'll be sure to give you guys that code towards the end of our presentation. Okay. But just in case for you guys that don't have it, I am going to give you guys some freebies. All right. Because I want you to open it and kind of read along and use that as one of your guides. Okay. Shantae said is in our membership. Yes, it is in your membership. It should be in a nursing downloads. Okay, the lab values, this lab values. But I'm about to give it to you guys. So this specific page or these specific pages, I'm about to give it to you guys now, so you can just go ahead and download it. Give me 2 seconds. Okay, you should be able to see. You should see a file being shared with you guys, and it should be called NCLEX Labs PDF, I think, something like that. it should be a PDF for NCLEX Lab Values. All right, should look exactly like this, and it should be, when you download it, it should be like 7 pages. Let me make sure. Yes, it should be 7 pages. I hope let me just make sure. All right, that is it, right? Open it and make sure. But that should be 7 pages, NCLEX Lab Values. All right. What's included is adult values and peds values. Okay. You'll probably notice it'll look like the information is duplicated, but it's not. One has the information. The other one is kind of like a test yourself worksheet. So have the name of the lab values, but it won't have the actual numerical values. Okay, that's where I want you guys to test yourself, especially after this, so you can make sure that you really comprehend the content. Okay, so I'm going to send that to you. And this last one, and this is what we're going to be, actually it might be 2. This is what we're going to be going over. We're going to be going over all of these things, actually. Okay. Let me see if you guys have this one. All right, and then I just shared another one with you guys. Electrolytes. Okay, awesome. Make sure, I'm glad it works. Perfect. All right. Now, if you guys open it and you see it may look like a nutritional value, a nutritional label. That was my inspiration behind designing this when I first designed this. I used this when I was actually like bedside and actually needing to see, my lab values and stuff like that. So I actually created this. I created a good number besides the ones that I did for T's a little bit later. But I created these because I actually had a need for it. Like I needed it within my workplace and within the setting that I worked at. I needed like a reference sheet. And so I wanted to like make it, I don't know, cute and themed. So I did it after a nutritional nutritional label. Yeah, nutritional label like this. But this one is just blue and silver. Okay. Are you only seeing the first file available? Are you not seeing another one called electrolytes? Let me look. Okay, that one's not coming up. Let me go ahead and reshare that for you guys. All right. Okay. Let me share that with you. Oh, it's because it was a picture. My bad. Let me go ahead and do that for y'all right now. 1 second. Let me find what that is. Here we go. All right, let me. Okay. Okay, here we go. All right. So sorry. That I have to make it into a PDF, but that's fine. It will take me no time. Thank you guys so much for your patience. I know we like the beginning, that whole volume thing was getting on my nerve. I don't know if I was gonna survive that. So thank you guys for being super patient. Okay, here we go. Just want to make sure, yeah, okay, y'all can see that. Okay, let me go ahead and share that with you guys right now. Hold on. Files. Delete that one. Add a new one. And attach. Wait. Oh, okay. I was about to say, hold on. I just did this. All right, here we go. You should be able to see it now. Wait. You should be able to see it now. You should be able to see it now. So it should be either right under or above the first one, the NCLEX Lab Values. You should also see electrolytes on the electrolyte cheat sheet. Got it? Perfect. All right. Let's look and see. Perfect. All right, so let's go ahead and go over, let's go ahead and begin our study hall session. All right, so like I said, common lab values, common NCLEX lab values that every nursing student needs to know in order to be successful on this NCLEX. Okay, so here's a couple things that you should know about NCLEX and lab values. Okay, now as far as normal values, all right, normal values, I don't know if you guys have peeped this yet, but normal values can/will vary between institutions, between facilities, and between hospitals. Okay, what that basically means is that the lab at whatever institution or facility has their own set of parameters that they go by. Okay, and like usual, or like most of the values within our body, sometimes that it basically waxes and wanes, like the actual limits, depending on the person, the chemistry, the body chemistry, all that can cause the normal values to fluctuate. All right, a little bit from what you know. And what I mean by that is like perfect example, platelets. You know, platelets, it's usually 150,000 to 450,000, but there may be some textbooks that I've seen as well that say, you know, 150 to 400,000. So, you know, that it depends on the actual institution and their parameters that the lab is using when they go to create this book. What I will say, though, in addition to that, is that even though lab values and those normal lab values can vary, the NCLEX is going to give you ranges or give you values way outside the range. Okay, so let's say normal range. Let's talk about like BUN, perfect thing. Some cheat sheets, some facilities, and some books say that the BUN, blood urea nitrogen, is 7 to 21, but there's some books that say 10 to 20. Okay, so you see the margin of, I wouldn't even say error, but those margins are very close: 7 and 10, 20 and 21. Now on the NCLEX, what they're going to do, they're not going to like test you on values that are super close to the normal range. Okay, so for 7 to 21 for the BUN, they're not going to give you a 6. They're not going to give you like an 8. They might give you an 8 to let you know that it's normal, but they will usually give you ranges either that are super normal or outside the range. They're not going to give you any borderlines because they want to confuse you, because once again, those lab values can vary. So just know that. I don't want y'all going around cussing me out and other people out and be like, Sam said it was this, and that. And who's another person? Simple Nursing said it was this, and that. Don't go cussing us out. Our books just may be different. Okay. But once again, the NCLEX, they're not going to ask you what any of those normal ranges are. They're not going to be like, hey, Kamaya, they're not, what's the normal range for BUN? You know, they're not going to ask you that. What they're going to do, okay, for this NCLEX as well as especially next gen, but they're going to do it for this NCLEX as well. They're going to, they're testing your comprehension. They're testing your ability to assess and analyze results, so you can decide on what the best course of action is going to be depending on that value. Okay, so they're not going to just kind of spell it out all like black and white. They're not going to do that. They're going to like almost like give you a case study. They're going to give you some information, you know, almost like a real clinical, as if it was, they're setting it up as if it was a real clinical event. Okay, you have a patient that came in, you did some blood work because they had a physical. As you're looking at the blood work, you notice that the patient's BUN is 130. What's going to be your next best priority? Something like that. That's going to be something, that's going to be a question. Well, that's going to be similar to what the type of question that they're going to ask you. Okay, that's similar. It's that setup basically is going to be very similar to what I just said, depending on what they want from you and what they're looking for you, or looking from you. Okay, looking for from you. There we go. So once again, they're going to ask you to analyze and assess that amount to determine what you're going to do next. What does this mean? Okay, first you got to determine if it's in or out of normal range. And if it's in or out of normal range, especially out, what would that look like? Okay, that's when they ask you about, you know, signs, symptoms, clinical manifestations. How would this look? How would this patient present if their sodium was super low or, you know, super high? What would be a manifestation, or what would be a presentation that the nurse would expect? Okay, like I said, depending on the question, they can easily flip that, reverse it, and say which of these is not a cause for concern for if the patient's blood value is I don't know, the blood sugar is 3 or something like that, you know, which they can easily, like I said, reverse it. And that's all to make sure that you understand the content, because the content's not going to change. That's going to stay the same. How they ask it, how they're going to try to, you know, assess you and make sure you have, you grasp and comprehend the content, that's going to change. But the answer and the content, that's going to be consistent all the way through. So lab values may not be consistent, but what you should do based on if that lab value is high, normal, or low, that's going to be consistent. You know, we're always, if something is abnormal, we're always going to make sure the client is safe, communicate that with the other doctors, staff members, parts of the interdisciplinary team, those things. Okay, those are our nursing interventions, and that's what they're really going to be testing you on. Okay, so I don't want y'all to go and like just memorize numerical values. No, you have to memorize the whole journey. You have to memorize and really know the lab values, which then will help you determine whether or not it's high, low, or normal. And then from there, you have to take it another step further, determine, you know, what would that look like clinical manifestation wise? What would that client look like if they had a level like this? Okay, so it's different steps that you kind of have to remember. Okay, does that make sense? Just want to make sure. Has anyone ever noticed the variation of lab values? If so, what is a lab value that you usually see a different number for? Whether it's your textbook versus your instructor versus Susie and I go to Chamberlain over here, whatever, or whoever. Give me an example if you've noticed it. Give me an example of a lab value, not the actual value, but just like the name of the lab. Give me an example of a lab value that you've noticed that with. Monique said calcium. Yes. I'll see like 8 point. Look, where my electrolyte sheet? Because I'm gonna have to pull that up too. Where is my electrolyte sheet? Calcium. Okay, yes. All right. So like on here, it's 8.6 to 10. I've seen 8.6 to 10.2. So yes, calcium is one that I've seen as well. You know, BUN, like I just explained, absolutely. You know, it's another one that I see that's almost like never the freaking same. Creatinine. I don't know why that's like almost everybody's lab. It's like different. I'll see 0.6 to 1.5. I'll see 1.6, 0.6 to 2. All these things. But creatinine is definitely one. Blood glucose. Yes, blood glucose. But what does stay consistent about blood glucose is the number that it should not go below. Like hypoglycemia is always going to be, you know, like below that certain number. Was it 60? And then it's like dangerously low. It's like below like 30 or something like that. Those things stay consistent. Hypertension is another one. Like blood pressure is another one. Whether it's hypertension 1, 2, super saiyan, I don't know, all these things. But hypertension is another one that changes like every year, every couple of years. But yeah, just want to make sure y'all get that part down so you're not alarmed, if you're not freaked out and stressing yourself out about. Because I'm not gonna lie, I definitely have. Okay, so like I said, labs to know. We can really start with our electrolytes. Right here, it have calcium, chloride, glucose, potassium, phosphorus, sodium, magnesium. Those are usually the basic electrolytes. Panel wise, I believe that's your basic metabolic panel. Is it? Let me make sure. Because, you know, there's a basic and a comprehensive metabolic panel. Yes. Basic metabolic panel measures like the typical blood chemicals, BUN, carbon dioxide or CO2, creatinine, glucose, serum chloride, potassium, sodium, and calcium. Okay, those are going to be your stuff for your basic metabolic panel. Okay. Okay, let's go ahead. Let me ask you this. All right, calcium. We have 8.6 to 10. What is calcium? When you think of calcium, what do you automatically associate calcium with within the body? What do you automatically associate calcium with? See how it's 8.5 to 10.5 here? But before it's 8.6 to 10. That's he's perfect example. All right. Janai said milk and bones. For me, it's bones and stones right here. Okay, so open up that electrolyte cheat sheet that I gave you guys. When I think about calcium, I think about the strong bones and teeth. I think it was like in a cereal commercial. I don't remember. But when I think about calcium, I think about strong bones and teeth. I think about vitamin D. And I think about milk, health. Hence this glass of milk right here. Y'all know I'm a visual learner. So if there's something that can visually represent what I'm trying to learn / say, I'll remember it 10 times faster and longer. Okay. So calcium, bones and stones, and or milk. All right. So the range right here we have is 8.5 to 10.5 or 8 point whatever to 10, 8.6 to 10. Yeah, it varies very slightly, but it still varies. Okay. So if we get a value that comes back and it says calcium for this patient is 19, that's going to be consistent. That answer, what that analysis of that lab value is going to be the same with this range and the range a couple slides ago. All right. So if we have a blood value that comes back for calcium and it's 19, you would expect to see, if you look down here, right under like hypercalcemia or hypocalcemia, you have the common causes of these, and you also have signs and symptoms. Okay, signs and symptoms or clinical manifestations, same synonyms. All right, tomato, tomato. If you have a number that is a calcium lab value that comes back at 19, what would you expect to see in that? How would you expect that patient to present? Okay, what would be some clinical manifestations, signs, and symptoms of a client whose calcium level was 19? That's a type of NCLEX question that you're going to get, that you would get about lab values. That's a perfect example. Perfect example. All right, so I want y'all to answer that. I want y'all to answer that. It says it right here. Just pick one of these. All right. And I want y'all to type it in there. Y'all know writing or typing something, even if you know it in your head, is going to further lock it down in your memory. Okay. It's almost like a muscle memory type thing, but as you write it and or type it, it's like you steer it into your brain. Okay. So if we have somebody that comes back with the calcium level of 19, give me a clinical manifestation or sign and symptom that client may be presenting with. Bone pain, muscle weakness, Right. A lot of people are saying bone pain and muscle weakness. Absolutely. What I do, and kidney stones. I wanted to add that kidney stones in there. And that's why I put bones and stones, because for me, when I was in nursing school, this always got me. And y'all know, once you get got once, you'll never get got again as far as that same thing. So I got with calcium, because when I think about calcium, I always remembered bones, but I would forget stones. So I had a question, and it was asking me, all this stuff, and confirming the things that I already knew, but then I totally forgot the stone part. Obviously a buildup of calcium can cause kidney stones. Okay. So what the question was, like, if somebody comes in with, if we have a client that comes in with like severe pain when urinating, something like that, what would would that be a manifestation of hypo or hypercalcemia, or like none of the above? And I totally got that wrong. But once again, you have to think in steps. All right. If someone has a kidney stone, they're going to have that severe pain, burning when peeing, all that stuff. Those are going to be the clinical manifestations of those clinical manifestations of hypercalcemia. Okay. So take a look and note the causes and signs and symptoms of both hypocalcemia and hypercalcemia. All right, hyper, when you have too much calcium in the blood. Hypo, when you have too little or not enough. You're deficient in calcium. Okay. Like I said, common causes, signs and symptoms for hypocalcemia. The trochos, I don't know how to say it, trochio, and the Shavastic sign. Know which is which, okay? Know how to assess for the trocho and the Shavastic sign. Know how, like what would happen, or know what action would happen, or what would happen, or what it would look like if either of those signs were positive. So if you had a positive trocho sign, what would that look like when you're assessing it? How would you know that something is that trocho sign is positive? And same thing with Shavastic. All right, let's go. Let's do it together. Okay. The trocho sign. I know. I feel like I'm just butchering this word, and if I am, I'm so sorry. But yeah, I'm so sorry. All right. So trocho sign. Does anybody know what that is? Does anybody know what trocho's sign is? Same thing with Shavastic. Can you tell me the difference? What is the difference between trocho and Shavastic signs? Can anybody tell me that? All right, Marjorie Joe said cheeks. Which one's cheeks? Shavastic or trocho? Which one is the cheek? And I'm going to show you how you can remember. So cheeks is Shavastic. All right, cheeks is Shavastic. All right, C for C. Cheek, the C in cheek is the C in Shavastic. That's what you can use to remember. All right, that is the twitching of the facial muscle. It's not specifically the cheek, but it's in the cheek region. All right, it's the twitching of the facial muscle in response to tapping over the area of the facial nerve. Okay. Right, Shavastic, cheeky smile. Thank you. Awesome. C for C. Shavastic is cheeks. I feel like I'm butchering that word too, but y'all get what I'm saying. All right. So trocho or trocio, all right, that is the contraction of the muscle in the hand and the wrist. It's a spasm. It's carpopedal. There we go. It's a carpopedal spasm. All right. And that occurs when you have the arm and it's compressed within the blood pressure cuff. So you get it real tight. And that involuntary kind of contraction of the muscle hand or the muscles in the hand, that's a result of hypocalcemia, not enough calcium. Remember, calcium plays a big role in muscle contraction. Okay, so if you don't have enough, it's wigging out. Like the contractions are just kind of just wigging out. So yes, that is Trocho. Think of the blood pressure cuff. And that would indicate, and that involuntary contraction, that spasm would indicate a positive Trocho sign. And usually when it is positive and you see their hand, it looks, this is what it usually, all right, hold on, let me go make sure y'all can see what I'm doing. I look crazy. It's a little like I'm talking to myself, but y'all see what I mean, man. This is the presentation of the arm. This is what you would see. This is how you would see that arm. This is how that arm would look when you have a positive Trocho sign. Okay. All right. That's that carpal pedal spasm. All right. It's spasming like at the wrist. Well, it's flexing the wrist and the metacarpal joints. Okay. That's so it's going to look like that. All right. What's a good way to remember Trocho sign? What is a good way to remember Trochos? Marjorie said cranial nerve 7 equals nerve hyperexcitability. Absolutely. Great job. How would we remember? Well, for me, honestly, because I know those were the two signs that you assessed for hypocalcemia. If I remembered that Shavastic was cheek because of the C's, then I just know that Trocho was the other one. That's how I remember it. Work smarter, not harder, love. Trocho, twitchy wrist. That's cute. I like that, Monique. I like that. So Shavastic, we got a cheek. Trocho, we got a twitchy wrist. Okay. That's good. Love that. Love that. Write that down if y'all got that. Okay. All right. So next one, very, very popular. All right. NCLEX loves this. Potassium. Potassium. Absolutely. Potassium. All right. Potassium's range is 3.5 to 5.0. That's, I think, one of the more consistent lab values that I've seen across any and all facilities and publications. 3.5 to 5 is that's just a number. It's like all our bodies agree, like, look, it's going to be 3.5 to 5, and period. Okay. Oh, wait, I have something else for you guys. For potassium, I have another. I wouldn't even say cheat sheet because it's a couple cheat sheets, but it's included in like freebies. But since we're all here, I'm just going to give it to you guys here, so you don't have to go through and download a whole bunch of things and subscribe, all that stuff. I'm just going to go ahead and grab it for you and put it here. All right, this one's specifically for potassium. Like I said, because potassium is so, I wouldn't say so popular, but there's more of an abundance of potassium, I believe, in extracellular fluid. I'll look in a second. All right, so, oh, I almost gave y'all something blank. Ooh, that would have been so shame too. So shame. All right, here we go. Is this it? Yep. Perfect. All right, I'm putting that up for you guys. All right, so like I said, this one is not exclusively, but specifically on potassium, the importance of potassium, everything you need to know about potassium. And I want to do a one-off on this, on ion and slash electrolyte specifically because of how important slash how much of an abundance it's found in the body. Go back to it right here. Hold on, let me see. All right, you guys should see it. Sharing it. So I did this keeping up with the Kardashian theme. It's called Keeping Up with the Potassiums. And instead of, a P for potassium, it's a K because, the symbol for potassium is K. So I will put Keeping Up with the Potassiums with a big S, with a big K in the middle. And potassiums kind of sounds like Kardashians, not really, but kind of. So, and at the time I was binge watching like season 18 of Keeping Up with the Kardashians. So I was like, oh, let me go ahead and do it based off of Keeping Up. So I came up with what you guys should see now. Just let me know if you've got it. Keeping Up with the Potassiums. It is 6 pages, a 6-page cheat sheet, and it goes over the lab value. All right, it goes over the fact, facts about potassium, that it's the most abundant intracellular cation. All right. Quick thing. If an ion is a cation, is it going to have positive, negative, or neutral charge? Yes, you do need to know this. All right, perfect. I'm so glad you guys got it. Awesome. All right. So yes, if an ion is a cation, is it positive, negative, or neutrally charged? If you don't know the question on that, you can look on page 2 of the Keeping Up with the Potassiums, right next to the K potassium lip kit. Y'all see that? It's so cute. Positive, absolutely. It is positive. Hold on, I want to show y'all this really quick. I want to show y'all that really quick. Okay, y'all can see that, right? Y'all can see that? All right, see? Keeping Up with the Potassiums. All right, if we scroll to the second page, right next to the potassium K lip kit right here that I drew, you have most abundant intracellular cation. Now, what helps me remember the charge for cation, this T I turn into a plus sign to help me remember that cations are positive ions. Okay, the opposite of a cation would be an anion, A-N-I-O-N, and the N stands for negative. So that's what helps me remember. Cation, the T is really a plus sign for me. And that helps me remember that it's positively charged. It's a positively charged ion. All right. It helps facilitate electrical impulse conduction, cardiac, skeletal, and smooth muscles. It also helps move glucose into the cell, which is very important. And it's mostly excreted via the kidney. Okay. So that's what you're going to have here. We're going to have a couple of facts, once again, about potassium right down here. These are foods that are high in potassium. This is kind of like a common tip: dilute and administer potassium slowly if given via IV. However, you never give potassium via IM or IV push or sub-Q. Okay. Oh, Bible. Sometimes I look at things, I'm like, that was cute and creative. All right. So potassiums, once again, too much of something is a bad thing. Too little of something's a bad thing. Same thing with potassium. Too high or too low, they can both be life-threatening because, once again, it helps facilitate electrical impulses and impulse conduction. All right. Especially for those muscles. which muscle or which one of the muscles in our body is super, super important, and you don't want to electrically short, I'm going to give you the answer. It's your heart. It is your heart. So arrhythmias, cardiac problems, that's almost always going to show up if you have some type of deficiency or just imbalance, period, of what's this thing called? Potassium. All right. So this is going to be some more of what you would see as far as signs and symptoms. If you have hypo or hyperkalemia, so you're going to see these EKG changes because, like I just said, the cardiac State Farm is there. You're going to have EKG changes, and you want to see and note what those EKG changes would look like, because once again, that can be a question on the NCLEX as well. All right. Here's some medications for it, and you guys can go through it. Okay. Yeah, you can go through it. Let's go back here. Let's put it back. Let's put it back. There we go. All right. So hyper and hypokalemia. Here's a little not sneak peek, but here's a little short excerpt of just like really quick, like facts and things that you definitely need to know. But if you want to know a little bit deeper and further into like reasoning why and like the pathophys behind everything, you can definitely look at the Keeping Up with the Potassiums cheat sheet. All right. But like I said, monitor cardiac function when it comes to potassium. When all else fails, the answer on the NCLEX is going to be potassium. Wash your hands. That was a running joke. I don't know if that's still accurate now, but potassium and cardiac, they're usually always being tested on something. It doesn't even have to be med surg or like the cardio anything. It somehow always relates back to that. Once again, because it's the most abundant cellular cation. So it's very important. It has to do with a lot. It plays a role in a lot of functions. All right. Next thing we have is sodium. All right. Sodium 135. Oh, wait, hold on. I forgot to tell y'all how to remember potassium. Potassium. You see these bananas? All right. See these bananas? 3.5 to 5. I think about that means remember 3.5 to 5. I went to the grocery store and got, you know how when you get bananas, like you get it in the little, is it called a bushel? What's a pack of bananas called? Pack of bananas called a bunch. Okay, sure. A bunch or a stalk. So when you get like the bunch or stalk of bananas, like you'll see one that'll be like super thick. It'll have like 8 in it. Then you'll see one that's not too much or doesn't have too many bananas. It's like 3 or 4. Then you have like a 6. When I think about potassium and 3.5 to 5, I think about there is 3.5 to 5 bananas in the bunch. That's what I think about. That is what I think about. That's what helps me. Okay. Also, it's in that thing, but make sure you know foods that are high in potassium. All right. Make sure you know foods that are high in potassium other than bananas. Give me another one other than bananas. Okay. All right. Let's go back to salt, sodium. All right. The range for this, this is another one that's consistent across multiple publications, 135 to 145. That is the normal range for sodium. All right. What you want to remember about sodium, salt, whatever you want to call it, is that water follows salt. Okay. And what that means is that where you will find a high concentration of salt, expect to find an excess amount of fluid as well. Okay, because that's your body trying to naturally dilute that salt. All right, so if you're feeling real salty for whatever reason, whatever's feeling really salty, your body's going to try to correct that and add some water to it. All right, that's the equivalent of when you add too much like sugar to the Kool-Aid, and that thing's super, super sweet, like diabetes sweet. And so you try to just naturally, not naturally, you just try to dilute that thing as much as possible by what? Adding more water. We're going to add some more water to this and try to dissolve this and try to just at least make it equal, you know? Think about the same thing, but just with salt. Okay, in your body. Water is going to follow that salt. It's your body's way of trying to compensate and dilute and balance all that sodium. All right. Hyponatremia, hypernatremia. Once again, hypo is low, hyper, sniper. What did I say for hyper? I can't remember. But hypo was low and hyper is up. High. I have to think about something. Okay, hypo is low, hyper is high. Sure. All right. Once again, causes and the common signs and symptoms of both hyper and hypo. All right. One of the more important ones, especially the more common ones, as far as electrolyte imbalances, especially within diabetes insipidus. What's the other one? Yeah. I'm thinking about the endocrine disorders and stuff like that. But yeah, look at the causes of hyponatremia and hypernatremia. All right, hypo is once again below, not enough. What would cause someone not to have enough salt in their body? Excess water intake. Okay, you're diluting all that salt with more of the solvent, which is water, than the solute, which is salt. Burns. Remember, dehydration is one of the big concerns for anyone with burns. So when you're losing that water, you're also losing that salt. Okay. CHF, diuretics, that's when you see hyponatremia, hypernatremia, too much salt, excessive salt intake. Like you just taking the salt and vinegar chips and just, y'all used to do that? Don't lie. I used to some salt and vinegar chips and like crunch up like a hot sausage or something. Ooh, I'm telling where I'm from. Anyway, excess salt intake. You just taking and just doing like that too much. It can cause hypernatremia. Okay, diabetes insipidus. All right, when you think about diabetes, think about urine being diluted, and with diabetes insipidus, what they're doing is peeing a lot. Always peeing, always urinating out. When they're constantly losing that fluid, they're once again losing that salt, waterfall salt. Okay, so that constant excretion of that water, especially with that urine, I should say, that salt content is going to be in that. And if you're constantly losing, I said waterfall salt, sorry. If you're constantly losing water, then you're once again kind of like draining what would dilute the salt. So it's just causing your salt to build up in your body, which is why you would have hypernatremia if you just was urinating all day. Imagine putting a hole in that Kool-Aid cup that we was talking about. All right, you just did all that balancing, but then you put a hole into it, so it's constant. The fluid is constantly going out more than it's coming in, so the fluid is able to, those levels are fluctuating, but the actual salt, sugar, whatever concentrate or salt use you want to think about, but that's going to accumulate once again because that water level is leaving. Does that make sense? Signs and symptoms of both: flushed skin, increased BP, peripheral edema, thirst, decreased urine output. Okay. I don't know about y'all, but if y'all ever had something that was really salty, especially like seafood, if you've had like a batch of really like salty crabs when like the sauce or whatever was just really, really salty, the first thing that you going for, not Red Bull, but water. That thirst from that salt is unreal. Unreal. Okay. The increased BP. When you think about sodium, so you always tell people with blood pressure problems, ease up on the salt because that's going to what? Hike up your BP. All right. So same thing with this. All right. Next thing that we have is magnesium, 1.5. Well, how do y'all remember 130? Sorry, for sodium, 135 to 145. How do you guys remember that one? All right, so it's 135 to 145. How did I remember that? Actually, I do remember because it made no sense. I would always say like, y'all know my mind is crazy. I would say she's always salty between 1:35 and 1:45 p.m. I swear to you, that just clicked in my mind and I just ran with it. I had the energy to try to think about something else. And it was just so odd that it stuck with me. You're right. Janine said, I don't know. It was just drilled into my head. Yeah. Yeah. Every day she is salty from 1:35 to 1:45 p.m. You can remember it like that. All right, let's go on to magnesium. All right, 1.5 to 2.5. 1.5 to 2.5. How I remember that was magnesium. I would think about a magnifying glass. And when you use a magnifying glass, it enlarges the picture 1.5 to 2.5 times bigger. Like 1.5x to 2.5x. Those are like you remember on the microscope, those were like levels of magnification. So 1.5 magnification to 2.5 magnification. That's how I remember magnesium. Does that make sense? All right. Same thing with hypo and hypermagnesia. Too much or too little. Okay. When you think about magnesium, think about the fact that it is the inverse of phosphorus. It is the inverse of phosphorus. And what that means is that think about like a seesaw. When one is low, the other person's high. Kind of think of like a seesaw. So if magnesium is the inverse of phosphorus, if magnesium is high, that means inversely, phosphorus will be low and vice versa. When phosphorus is high, magnesium is low. All right. So as long as you know almost like the value of one, or as long as you know the like the assessment of one of those, magnesium, phosphorus, whether it's high or low, you'll know the other one because of that inverse relationship. Okay. When you think about magnesium, I think about two things. Well, I think about magnesium sulfate, as well as magnesium in antacid. So I think about Tums, which is why I have this Tums picture right here. Like magnesium, what's the stuff that's in, dang it, it's really gonna bother me. Magnesium citrate. That's that like clear stuff that people get, that you get to have a big blowout poop session. Like it is a laxative. Okay. So overuse of magnesium, especially laxatives or antacids that can really mess up your body, your electrolyte imbalance. Well, your electrolytes will be super imbalanced. Okay, these are the causes and signs and symptoms. All right. Causes for hypo, chronic malnutrition, diabetic ketoacidosis. Causes of hyper, milk of magnesia. Thank you, Monique. Thank you. I was like, something else that I'm thinking about, milk of magnesia. And I don't know about y'all, but I was a real I still am like a real makeup freak. I love makeup, all that stuff. So I don't know about y'all if y'all have ever seen like the YouTube video hacks or whatever. I was a really oily girl. She had real oily skin, like really oily. I would put something on and my face would be just consumed in oil because I was unbalanced. My face was unbalanced. But anyway, what they used to say, and this is some people probably still do this. If you take milk of magnesia and use that as a primer, you will be oily no more. Have y'all heard of that? Are any of you guys YouTube girls? Primer. Thank you, Monique. Because I feel like some of y'all lying. Y'all trying to make me be crazy out here in these streets. Okay. Yes. Use the milk of magnesia. Milk of magnesia, whatever, as a primer. But yes, milk of magnesia, magnesium. Okay. All right. Moving on. Chloride. Okay. Chloride. When I think about chloride, I think about chlorine. When I think about chlorine, I think about the pool. Summer 2022. Whose pool am I pretending to go in, but I'm not really going to go in because it's hair, love. But I will stand next to the pool, be cute, wear a nice little cover-up 2-piece, take some cute pictures for the gram. I'll do all that, but I will not be participating in the chlorine. Absolutely not. Aesthetic purposes only. All right, so chloride, 95 to 108 milliequivalents. 95 to 108. I think chloride's another one that's that varies. See, 95 to 108 is what we just said right here. It says 99 to 109. Y'all see what I mean? Y'all see what I mean? But NCLEX is not going to give you a value saying, hey, what's 90 is 97 low, normal, or high. They're not going to give you 97 because of that range. No, they'll give you like 17 if it's low or something like that, and like 134, 135 probably for high, something along those lines where it's like way outside the parameters. Okay, let me go back to my good sis chloride right here. All right, so hypo and hyperchloremia. All right, too much or too little chlorine in the blood. Okay, let the words help you. Let the words help you when it comes to like terminology, prefix, root, and suffix. Let all that help you as much as possible. Okay. Funny thing about chloride, it usually pairs with salt, well, sodium specifically. All right. So the chemical symbol for chloride is Cl. What's a common thing that y'all all hear about when it comes to sodium and chloride? I just answered it myself. Sodium and chloride come together to make what? Really, Sam? But I'm asking for real. Tell me. Sodium and chloride come together to make what? Come on, where are the girls? Normal saline. Normal saline. Absolutely not. Well, that's absolutely not. Absolutely. Now, normal saline. What kind of fluid is that as far as tonicity? What kind of fluid in relation to like concentration? What kind of fluid is normal saline? as far as isotonic. Thank you, Monique. Normal saline is isotonic, okay? And that is important, especially for us nurses to know, because when it comes to hypotonic, hypertonic, or isotonic fluids, what that's basically going to let us know is it's telling us what conditions and what situations we can give certain types of fluid. Okay, because once again, the tonicity of these fluids, if they're different, one's hyper, hypo, and isotonic, then the effects that it's going to have on the body is going to be different. Okay, so if you have somebody that is actually, hold on. Yeah, if you have somebody that is dehydrated, you just have someone that's dehydrated, they need fluid resuscitation. All right, they need a fluid replacement. If you have somebody that's dehydrated, they would get isotonic, an isotonic solution, aka normal saline. That's what they would get. Do I have my? Hold on. Let me look at one thing. All right. If you have the Ultimate Nursing School Bundle or the first semester, I'm going in IV therapy really quick. And I'm going to this page. All right. This is replaceable IV fluids. All right. Now, we just said isotonic. That is normal saline, and that's usually 0.9% normal saline, or NaCl, sodium chloride. All right. Another type of isotonic solution is lactated ringers. All right. So what that's going to do, isotonic solutions are best for treating dehydration. Okay, absolutely. Another isotonic fluid is D5W, or dextrose 5% in water. Okay, it's important to know the fluids and other types of isotonic, hypo, or hypertonic fluids, because NCLEX will ask you. They're not going to always use NaCl. They're not going to always use normal saline. They may even try to just make sure you really understand that with normal saline, like there's a 0.9, which is normal. There's a 0.45 normal saline, which is hypotonic. And then you have hypertonic solutions where it's like 5% dextrose, or D5 in 0.9% sodium chloride, or 0.45%. Both of those are hypertonic solutions. Okay, hypotonic solutions, that's what happens when you have more water than solution. All right, so that's why hypotonic solution, low amount of solutes in the solvent. There we go. All right, so hypo below. What that's going to do is replenish cell fluid. Okay, it's going to replenish cell fluid. All right, so that's going to put fluid into the cell. Okay, that's going to put fluid into the cell, but you want to make sure you don't go overboard and cause like edema and stuff like that, because once again, it's replenishing the cell fluid within the cell. Okay. Hypertonic solution, that's going to treat hyponatremia right here. Hyponatremia, so low salt in the blood, and it's going to treat hypovolemia. All right, low volume of blood. That's usually going to come from hypovolemia, fluid volume deficit, like a hemorrhaging or something like that. If you're like bleeding and you need like your fluids, you need fluid resuscitation or fluid replacement, you need a hypertonic solution. All right. And like I said, that'll be D5 in LR, which is lactated ringer, D5 in half strength normal saline, which is 0.45%, and then D5 in 0.9% normal saline, which is just like normal, 9%. But that D5 in it, that's what makes it hypertonic. Okay. So just know that at least about chloride, and pair that with these with the fluids, because they go hand in hand. Okay. As far as the hypochloremia, hypo and hyperchloremia, it closely mirrors signs and symptoms of hyponatremia. So if you know one, you'll know the other. Okay, so chloride is 95 to 108, and what's a good way to remember 95 to 108? What's a good way to remember chloride? How did I remember it before? How did I remember it before? It's gonna bother me. It's on the tip of my tongue. I know it was the pool, but how did I don't remember the 95. It's the hysterectomy, y'all. Y'all know my train of thought is just out. Was there something you guys remember? Or what made you guys remember chlorine or chloride? I keep saying. Okay, yes. When you get in a pool, it's 95 to 105, 108, whatever degrees. I have 95 to 108. Thank you, Chelsea. It was temperature. Great job. Thank you. So when it's 95 to 105 or 95 to 108, whatever, the temp, it is hot. So you're going to go to the pool. The pool has chloride. Okay. Awesome job. Yes. Thank you. That's a great one. So write that down if you need help remembering that chloride. Okay. All right. Hold on. All right. So that was the majority of the electrolytes and stuff that you would need to know for like basic metabolic panels. As far as, let's continue it down here. BUN. See, BUN is 7 to 20. I've seen 7 to 21 before. BUN is going to indicate function of what body part, of what it's going to measure the health of what body part. Yeah, I'll say that. BUN, blood urea nitrogen. It's going to indicate the health of what body part. What body parts for BUN? Kidneys. Absolutely. Okay. So normal BUN level of 7 to 20, 7 to 21, any of that. So if BUN, well, I'll just say this. BUN, like I said, is levels 7 to 20 or 7 to 21. When you have a high BUN, when your BUN is more than 20, 21-ish, your kidneys may be damaged, okay? They're not working optimally. All right, so when you have an elevated BUN, it could be because, once again, your kidneys aren't working like they should. You're dehydrated, okay? And even heart failure. Those are things that can elevate your BUN. Now, as far as a low BUN level, That's usually caused by diet. Usually a diet that's low in protein, okay, which is going to make the client like that was going to make them have malnutrition. And overhydration also. So drinking too much can cause overhydration. Remember, I said too much or too little of something is bad. It needs to be just enough, but too much liquid can cause overhydration, which will cause a low BUN value, and not drinking enough can cause dehydration, which will cause a high BUN value. Okay. As far as women and children, or women versus men, male versus female, women naturally have lower BUN levels than men because of how we break proteins down. Okay. Awesome. So BUN, it's a good way to remember BUN. For me, I always remember like that girl ate 7 to 21 honey buns. That's exactly what I remember. Girl, I was so hungry, I could eat about 7 to 21 honey buns. That's how I remember it. Okay, so that's BUN, honey bun. All right. Next thing. Creatinine levels. Remember, creatinine is one of those levels where it like, I always saw something a little different. But as long as you know like the basic range, you're good. Okay, so creatinine here, 0.6 to 1.5. Usually I know 0.7 to 1.3. And I'm going to tell you why I go with 1.3. Because it helps me remember the normal value. All right, so creatinine is more, if your creatinine is more than 1.3, you've got a bad kidney. 1.3, bad kidney. So just kind of saying that in my mind and remembering that part of my mind, at least I know the top ends, I know the higher ends of the parameter. And that just helps everything else kind of go into place. If I know 1.3, I'm like, okay, 0.6 or 0.7 or whatever, to 1.3. Okay, it's almost like half of it. All right, 0.6 to 1.3 or 0.7, whatever. It's kind of like right there in the middle, like half of both values. All right, 1.3, bad kidney. Remember that. Okay. Creatinine is also, like I said, bad kidney. That's also an indicator of your kidney health, kidney function. Creatinine, if you have, almost the same thing with kind of BUN. If you have a high creatinine level, then that signifies like impaired kidney function or kidney disease. Something's not working right if those creatinine levels are high. Now, if they're low, I don't really see much. I haven't really heard much about low creatinine levels, but that's usually something secondary. Low creatinine levels can actually indicate liver disease, even though it's a kidney function indicator. If your liver is malfunctioning, that's going to interfere with creatinine production, which in turn would cause low creatinine. Okay. You can also get low creatinine from like muscle disease, like muscular dystrophy, muscle weakness, muscle stiffness, pain, and decreased mobility. So muscle diseases or that muscle disease can cause low levels Okay, because remember, creatinine levels, those are linked to the muscle. It's linked to muscle mass or the amount of muscle your body has. So if you're if you're malnourished and you're losing like body mass, if you're losing muscle mass, that can interfere with your, once again, your creatinine production, and it will interfere with that level and cause it to be low. Make sense? All right. Hold on, let me go back to, then it kind of goes hand in hand with total protein. Total protein, right here we have 6 to 8.3. 6 to 8.3. Yeah, that's the normal range. Okay. Now, high protein, that's going to, well, it's really going to go hand in hand with albumin. You know, there's two major types of protein in the blood, albumin and globulins. Okay. So I think right here. So right below total protein, you see albumin. Those two pretty much kind of go together. All right. It helps measure the total amount of protein in the blood. Okay. The total, well, albumin is going to specifically keep the blood from leaking out of blood vessels. It's also made in the liver. You know that. It's also made in the liver. Okay, so once again, if albumin is made in the liver and you have a low amount of albumin noted in your blood, then it could be caused by a malfunction of your liver. Okay. Now, as far as albumin, as far as protein, that total protein, if you have high total protein or high amount of protein in your blood, that can be a sign of like a chronic infection or chronic inflammation, like HIV/AIDS. Okay. It can also be an early sign of bone marrow disorder. For example, multiple myeloma, which is cancer of the bone marrow. I know that because my dad has that. And his high protein levels was definitely one of the initial signs. Absolutely. What else can I tell you? And then remember, I just said that albumin is made in the liver. So if you have too much, if you have high albumin levels, then that's going to definitely, what was it actually? Protein. Hold on. If albumin levels are high, and that can indicate, once again, liver or kidney disease, or a sign of dehydration. Okay, it's a protein made by your liver. 3.5 to 5. Albumin has the same range as potassium, 3.5 to 5. Okay, you can kind of let that help you. All that, y'all. I don't know if y'all have seen this. Did you see my one of my last posts on Instagram when I was talking about the Grinch having cirrhosis? The Grinch having cirrhosis because he has ascites real bad, jaundice real bad. Okay, and those are more than likely clinical manifestations of liver disease. He got to put that eggnog down, Mr. Grinch. No wonder he was so grouchy and mean. My man needed a paracentesis real bad. Okay, so albumin, once again, affected. It's a major protein made in your liver, so it's going to signify liver function and kidney. Okay, specific gravity. All right. Usually it's like urine specific gravity. All right. And specific gravity used to always confuse me, always. All right. So the normal range is, what is it? What do we have here? 1.010 to 1.030. I always learned 1.005 to 1.030. So like 5 to 30 instead of 10 to 30. But like we both just said, it's going to be off by a little bit, but that's fine as long as you know the basis of it. Okay. So yes, 1.005 to 1.030, whichever one works for you. If you have a high urine specific gravity, then you're going to have a high concentration of particles in the urine, because urine specific gravity that measures the concentration of particles in the urine compared to the urine, like the actual density of the urine. So if you have really concentrated urine, like, I don't know if y'all have ever seen and or smelled concentrated urine, usually when you're dehydrated or something. Lots of urine particles, not a lot of water. All right, not a lot of water. So it's going to be really concentrated, really like sticky and thick and smelly and really yellow. All right, that's going to give you a high specific gravity. A low specific gravity, it's usually when you have when you're overhydrated, when you have too much water. All right, when you have less particles than compared to urine. Does that make sense? Okay. So whenever you think about specific gravity, think about, kind of use it hand in hand or synonymously with concentration. If you think about urine specific gravity and you say urine specific gravity is high or low, reword it again and say, okay, that means the urine concentration is high or low. And so that would help you remember that. Okay. Bilirubin. Good old bilirubin. All right. Normal values for bilirubin is below 1. Below 1. Okay. Well, this says below 1. I've seen up to like 1.2, like 1.2 or less, but semantics, very small. Okay. Bilirubin, why is that important? All right. That is that yellowish substance that's made in your body during the process or the normal process of breaking down old red blood cells. All right. So it's found in bile. Kind of look at the word bilirubin, the BIL, like the BIL in bile. It's found in your liver. All right. And that also helps you digest food. So that's why when people have, like, for example, like the Grinch, when the Grinch has jaundice, that yellow discoloration of skin, sclera, mucous membranes, when he has that yellow discoloration, that's because it's an issue with bile production, usually too much of that bile because of a malfunction in the liver. All right. The liver is diseased. So that's that directly affects the bilirubin, which then shows up and manifests in that yellow discoloration, also known as jaundice. All right. Newborns have it. It's commonly like diagnosed in newborns, but that usually goes away on its own. It's usually when a newborn is born. When a newborn is born, they don't have enough. Like their livers aren't developed enough to get rid of that bilirubin, so the bilirubin just accumulates. Hence, that's why they get really yellow. But usually that just kind of clears up on its own. They usually have newborns like in front of this special like light, and like they consistently test those levels just to make sure that it is trending down, like that it is definitely something that's resolving on its own and doesn't have to be like taken over by, you know, a medical professional, a doctor, physician, whoever. But yeah, so newborns get it not because they drunk off milk. It's because their livers aren't developed enough. If you see it in other people, it can be a plethora of other things. You don't know what's causing that bilirubin to accumulate, but more than likely it's because of liver disease due to like especially alcoholic liver disease. Okay. Bilirubin. Bilirubin. Bilirubin had one chance. Like first name Billy, last name Rubin, had one chance. But I don't know, that's how I remember it. Okay. All right. So that was that was calcium through bilirubin. We went over the electrolytes. Okay, we are already kind of over. I was supposed to be done an hour ago. It's fine. But we're gonna continue on total cholesterol through platelets. That's your cholesterol tests as well as your complete blood count. We're going to continue that next week. Okay, we're going to continue that one next week. Same time, same place. Oh, I'll give you guys the link. It's fine. At 6 p.m. next week. Okay, remember there is going to be no replay. If you are not an enrolled member of the Study Bar community, you can be one at studybarcommunity.com. We lowered the price to $14.99 per month, or you can pay $150 a year for annual membership. Woo. But as far as our Sunday study hall, that concludes this week's. Once again, we will pick this right back up next week at 6 p.m. for our next set of lab values. Make sure you go over the files and stuff that I gave you guys. It's really going to come in handy. I'm going to test you. I'm going to test y'all. I'm definitely going to test y'all and pop up with some pop quizzes and see who is paying attention. Now, do not leave because I have a code for you guys. 1 second. All right. So I know I showed you, I gave you guys a couple freebies, but like I said, I want you guys to dive into that Ultimate Nursing School bundle so you can really get the full experience as far as like the visual notes and everything like that, especially if you like these freebies. Imagine what the Ultimate Nursing School bundle has. Okay, so let me go ahead and give you guys that discount code so you can get that. And that's my thank you for coming and spending almost 2 hours with your girl, for putting up with me and my audio issues earlier. I appreciate y'all so much. Thank you. Let me go ahead and grab that for you. All right. And our code for you guys. All right. And this code is not going to be a forever thing. There's definitely going to be a time limit on this code. Okay, you can use that 50% off until the end of the day today. All right, so I am going to give you guys this code for 50% off. And you can use that on the Ultimate Nursing School bundle. Yeah, the Ultimate Nursing School bundle. Let me get that for you guys. kits. I'm gonna give you the direct link. Okay. Once again, the normal value, it's a 400-page study guide. It's the complete bundle. It has fundamentals, maternity, peds, pharmacology, all that great stuff. 400 pages. Everything is digital. You can print it out, however. It's printable and digital. So you can get 50% off this as my thank you for coming to our study hall. This study hall, once again, is going to be weekly. And so I'm going to have you guys vote on what topics you want to see next. If you haven't done so already, after registering, it should have asked you like a question. But as far as like what topics y'all want to see next, but I'll definitely be asking you guys on social media as well. Give me a thumbs up if you like/want to continue these free Sunday study halls. Like I said, the topic's going to differ week to week, unless we have to do like a part 2 or something like that, just to make sure you guys really, comprehend it. So next week, we're going to go over the rest of these labs to know, and then we're going to finish that up with some like Jeopardy questions to make sure you guys are really understanding. Okay, so give me a thumbs up if this helped you guys in any way. If you love the cheat sheets that I gave you, the 3 cheat sheets that I gave you. Okay. Okay. And then, well, let's do this. All right. So remember, you have, I'll give y'all to like noon tomorrow to use this code. Okay. Hold on 1 second. Let me grab that for you. Copy link. This is for you guys. Don't know where the thumbs up is. That's so funny. All right. Here you guys go. All right. That is the link. Wait. Okay. Yep. So I just gave you guys okay. Blah, 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 blah. Awesome. Yes. So use code STEADY50. All right, STEADY50 for 50% off the Ultimate Nursing School Bundle, the Ultimate Nursing School Bundle only. And that's what you need because it has first semester, second semester, third semester in there. All right, so get normally $97, get 50% off of that. It's like $48.50. All right, can't beat that with a stick. Okay, so make sure you take advantage of that. This code is going to be valid up until noon tomorrow. I'm gonna give y'all some extra time to use it. It's gonna be valid until noon tomorrow. After noon tomorrow, which is Monday, June 27th, after noon, lunchtime noon, Eastern Standard Time, you will no longer be able to utilize that code and save 50%. You can still utilize maybe our other codes, but I think the lowest one, the highest is going to be like 40% off and not 50. Go ahead and get your extra 10% and just use the code, okay? Thank y'all so much. Once again, if you want to catch this replay, you can only do so if you are an enrolled member of the Study Bar community, all right? If you are a member of the community, hello, welcome, VIPs, what's up? This will be available to you guys tomorrow within your video vault, okay? So if y'all have any other questions, go ahead and you can email me. You can, if you're a member of the Study Bar community, you can message me. You get priority access if you message me as a member, especially if you message me on the actual Study Bar community app, which is members only. Don't download the app if you're not a member. The free Nurse Sam app, NCLEX Jeopardy, where you can buy your study kits, that's for everybody. But the Study Bar membership, Study Bar community app is only for members only. If you use that platform/app to message me, you get priority response and attention, especially if you have any questions about what we went over. Yeah. All right. Thank y'all so much. It is 8 o'clock. I will see y'all next week, Sunday at 6 p.m. right here, doing this all over again. Well, not all over again. We're just continuing. It's going to be a continuation of tonight. All right. Part 2. All right. Thank you guys so much. Y'all have a wonderful night. Don't forget to use that code STUDY50. You have until noon tomorrow. All right. thenursesam.com. Thank y'all so much. See y'all later.